How long have you been feeling like this?
I don't know, like 20 minutes.
Everything okay here?
No. Call 911.
Oh, I'm fine.
You're having chest pains. You can't catch your breath, and it looks like your arm hurts. Can we just loosen your clothes?
Oh, leave me alone. I just need to get out of here.
Sir? Sir! Sir!
EMS is on the way. Man, did he go into arrest?
Go get the AED. Do you know CPR?
Yeah.
Get the barrier mask out of my front drawer.
CPR is most effective when started immediately after collapse. Let's learn how to use the ABCDs on an adult victim.
Dummy Dan here is at least 8 years old, because in the world of CPR, that's the age we consider them an adult based on body weight and size. We consider a victim age 1 through 8 a child, and anyone under a year an infant. We'll get into how to help children and infants a little later. So now, Danny has had his whatever 100th cardiac arrest, and it's time to save his life. I just arrived on the scene. I see a man down. What do?
Run.
No, come on.
Assess the scene. Put on your gloves.
Excellent. Both right. The scene is safe. Put on my gloves. I arrived at the victim's side. Before I begin the ABCDs, what's next?
Establish response.
Tap and shout.
Excellent. Hey, are you okay? Are you okay? The victim is unresponsive. Remember, if you're alone with an adult victim, you go call 911 as quickly as possible. If a bystander is present, send them to call 911, get an AED, and come back as quickly as possible. Now we're ready to begin the ABCDs. As we practiced before, A, open the airway with a head tilt, chin lift. What's the most common cause of airway obstruction in an unresponsive patient?
The tongue.
Excellent. Now B, we check for breathing. Look, listen, and feel for breathing for no less than
5 seconds.
and no more than
10 seconds.
Correct. And it's clear this patient is not breathing. When they're not breathing, pinch the nose and give 2 rescue breaths, lasting 1 second each. After the breaths, immediately begin chest compressions. Compress the chest 30 times at a rate of 100 compressions per minute and a depth of 1.5 to 2 inches, like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Perform CPR in cycles of 30 to 2. These compressions are hard work and you're going to get tired quickly. If there's a trained bystander, rotate rescuers every 2 minutes. Do not stop CPR until the victim begins to move or an AED arrives. If the victim begins moving, place them in the recovery position, monitor for normal breathing, and be prepared to resume CPR if needed. And it's that simple.
You're having chest pains. You can't catch your breath, and it looks like your arm hurts. Can we just loosen your
No,
clothes?
leave me alone. I just need to get out of here.
Establish response.
Sir? Sir! Sir!
EMS is on the way. Man, did he go into arrest?
Go get the AED. Do you know CPR?
Yeah.
Get the barrier mask in my top drawer.
Open airway. Check breathing.
He's not breathing.
Give 2 breaths. Provide 30 compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Continue 30 to 2.
Here's the AED.
1, 2, 3. Hurry, put it on him. I can't stop compressions.
Apply defibrillation pads to patient's bare chest.
30.
Analyzing heart rhythm. Shock advised. Shock now. Press the red button now.
I'm clear. You're clear. We're all clear. Shocking.
Shock delivered. Begin
I'll take over.
CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 29, 30.
Analyzing heart rhythm. Shock advised. Shock now. Press the red button now.
I'm clear. You're clear. We're all clear. Shocking.
Shock delivered. Begin CPR.
He's moving.